Hi everyone, so this is video 2 of day 2. So I'm going over the meds with you. So the other thing is that, when you come out of this surgery, you're going to have some packing. And in my case, these are kind of plasticky, fan-like stents, and they have tubes on them so that you can breathe a little bit, but there's a tendency for them to get clogged up. So what they told me to do was to do bacitracin 3 times a day. And then there's also an extra moisturizing spray that I do morning and night, just while my nose is bleeding. And then the daily saline, which I showed you in the other video, the last video. So those things kind of keep it, especially the daily saline and the bacitracin. You kind of rub it on with a sterile like cotton pad, like a long Q-tip. They give them to you. And, you have to be careful. You can't go in there. Just like with the spray, you're kind of going on the outside because these things come they're like on the edge of your nose. You can't see them now because I've got my gauze on. But, yeah, so that's the one thing. Because if those tubes get clogged, you won't be able to breathe through your nose. And it's already hard to breathe through your nose because if you, are breathing through your nose, you sound like the creature from the Black Lagoon, but at least it's better to be able to breathe a little bit than not at all. Now, some people come out of this surgery with this packing. It's like they're like tampons that go way up. And when you have all of that stuff, you cannot breathe at all. And I'm glad I didn't have that. I don't know when they use that and when they don't use it, because I had not only, I had basically cartilage readjusted. I had a bone spur that had grown and had that removed. I had this turbinate thing done, in addition to sort of straightening out, my septum. So it was a bunch of stuff, but still I didn't have that packing. So the other thing is they'll give you a lot of this, and then you use the paper tape, and you will have significant bleeding. And anytime you do anything, like if you exert yourself at all, like even just walk across the room, or, you can have more bleeding. You're not supposed to bend down. You have to sleep, not flat. You have to be propped up. You don't have to be sitting up, but you have to be propped up so that gravity works in your favor. So, okay, so tomorrow I will do a video telling you all about what happened in the recovery room, like the operation and the recovery room. Because I think that's important to have for anyone who might be having this. But I'm feeling a lot better than I thought. I have no pain. It just feels like I'm under the weather because of all that stuff I have in my system. But other than that, all good.